just to kind of mix things up a little, I'm going to have this row go first, and then that row in the back, and then this row. And keep it to about 5 minutes if you can. Just present like what we talked about, and then any other little findings that you found.
Do you want us to go up front or stay here or sit?
You can assign one person, or
Sarah.
I wrote.
Okay, so we were in charge of microbial testing. So there's 3 different types: the culture, the microscopic, and the nucleic acid or the DNA test. The culture, the process is to remove all the supergingival debris, and then you take a curette, get a subgingival sample, and you have to transport it to the lab, and the bacteria have to be living. It determines the present pathogens and antibiotic use or resistance. Let me know if I'm saying any of this wrong, by the way.
Great, you're doing great.
The cons for the culture or the microbial test, the culture test, are it's costly and it takes time because you have to culture it out. The bacteria have to be living. The pros are it will pinpoint the bacteria, and then you can know which specific antibiotic to use if the patient hasn't responded to conventional antibiotic therapy. For the microscopic test, you have the phase contrast, which determines motility, and the dark field determines morphology and shape. Yeah, that's all it determines. It doesn't determine any specific bacteria. So the equipment and cost are cons. It would be costly for the office to have to buy all the microscope and all that. So in that, I was kind of wondering, it's costly for the dental office to be able to have that, but what would you charge the patient? Because it's costly for you to buy it, are you going to charge the patient a lot of money to do it?
Yeah, that's always a problem. I mean, you can charge the patient whatever, you know, I mean, but I don't know. To me, I think I would just use it as a patient education thing. That's for the microscopic one. That's what I would use it for, just for them to see what's swimming around down there.
Yeah.
And explain to them that the spirochete-shaped ones are the ones that are going to cause you a lot of grief. And if they have a lot of that, point it out to them. You know, anything that you can use like that, you know. At the convention this last weekend, they were saying, you know, you should never say, I saw blah, blah, blah in your mouth. You know, what you should say is, by looking at your x-rays, we can see. Because lots of times, you know, they think you're just in their mouth looking to find something. Mm-hmm. So a lot of how you use your wording is really good for getting them on board. So with something like that, you can say, we can see by looking at all these little bugs swimming around underneath your gums that you have this going on. So, yeah.
So that's what we put for our pro, is that it's really good for patient education. That the con is that it doesn't tell you which specific bacteria are there.
And I can tell you right now that if you can get a dentist to keep you in instruments, you're doing great. Let alone them buying some crazy microscope for you. So I'm just telling you that right now. I just want a decent probe and something to scale with. So, but it's fun to dream about, and you know, some dentists might be on board. They might be on board with that, and if you find one, yay! You know, that's a fun person to work for.
Okay, so for our last test, we had the nucleic acid or the DNA, and the sample is obtained through a sterile paper point inserted into the base of the pocket for 10 seconds, and it's placed in a vial and mailed to the test lab. It can identify 11 different pathogens. The sample that you send, they don't have to be living, right?
Yeah,
No, they don't have to be living. So the con to this is that you need radioactive waste disposal. Because of the sensitivity of the test, some bacteria bacteria doesn't have to be alive.
Great, that's great. A lot of good information. Okay. All right, anybody have any other questions on that? That was a good review of what we already talked about, but that's how I learn. I have to hear it a couple of times, so. Okay, so the back row.
Alright, now that Sarah's group shows up, here goes. We have the genetic assay one, and what was the first question?
The first question.
How it's obtained. Oh, it's how it's obtained. Okay, so we put saliva sample is taken and sent to the lab. If it's positive, there's 70 times more likely to have periodontal disease. 30% of patients have it. And then the second question was, what are they looking for? And it's the interleukin 1. And then with pros, we put, because it shows it's either positive or negative for the interleukin 1 genotype, so it's a simple thing to do. You can provide guidelines for antibiotic selections, because once you can find out the exact type, it has rapid results, which is really good. You can determine to monitor the patient closer and offer them the best preventative treatment and support if you know that they have this, rather than trying to have to guess. So we can maintain it as we go along. And then for cons, we put healthcare costs are expensive. The patients are more susceptible to onset and rapid progression of periodontal disease. And that's all we have.
Okay, perfect. Perfect. The key to that, there's just little keys with each presentation. With the first key, know which samples need to be alive, which ones don't have to be alive. That's important. And the key to the other one is the interleukin 1. That's what they're looking for if it's a genetic A6 test, is the interleukin 1. Okay. You guys.
All right, so we have the gingival clavicular fluid assays, however you say that. And so this is the test where they get these special paper strips and they stick them down into the sulcus, well, into the pocket actually, it's okay. So, and by this they're looking for not specific bacteria, but for enzymes, the post-derived enzymes. And there are the AST, which is the aspartate aminotransferase, which is the one that can determine whether they're going to get periodontal destruction in 3 months. And then there's also collagenase, and there are a few others. There's the PMNs, the B-glucuronidase and elastase. All of those are enzymes that can, and the ones that I mentioned at the end are the 6-month ones, that they can determine periodontal destruction in 6 months. The pros of this test is that it's really fast and it doesn't cost a lot of money. And you can do it just easy, chair side. It's good for in-office use, but the con is that, like I said, it doesn't identify specific bacteria, so you don't know what bacteria is down there, you just know that the enzymes are present. And you need a lot, a sufficient amount of enzymes to actually get results.
Okay. That's good. That's good. So this one is more based on enzymes, okay? And and the one in the middle was more based on what bugs are there. So that's good to kind of differentiate. And it's good to know which one we can detect in 3 months, which one takes, which one will present itself in 3 months, and which one will present itself in 6 months. Know the difference between that too. So, okay, you guys know this stuff. It's really good. I just have to say I'm really impressed with all of you guys, especially when I was in clinic the other day. You guys are on it. You really know your stuff, and I think that I'm looking forward to you guys coming out into the hygiene world and being my colleague in the end. So I think that's great. And applaud you, especially since you guys are done with your national board. Yay. Yes, so good. Yes, yes, and you will pass. You feel like you probably won't, but you will. So I'm not even concerned. And good luck on your, so is it in Ogden where you have to go for your, oh, it's here? Oh, you guys have home court advantage. It is huge. Mine was in Ogden. I remember I had to leave my kids with my mom, and we went out to Ogden. Me and my husband got a hotel in Ogden, romantic. And I was like, oh, this is beautiful. He was my patient, and anyway, he's very nervous about dental treatment, so I wished I hadn't asked him to be my patient, but we still did fine. I still passed. So, yeah. Yeah. So that's great. I go through phases. Like today, I'm going in at 2 o'clock. I happen to have 2 root planings, so I'll be numbing them up for that. And then a lot of times, how they schedule me is the, you know, if they have a cavity that's just kind of a little sticky, then the doctor will say, well, just schedule with the hygienist and then with me in 6 months. So then I clean them, get them numb, send them on to the doctor. And then sometimes just to help the doctor out, if I'm not too busy, I'll go in and do some anesthesia for him. He does a lot of, he did like an extra residency for oral surgery, so he does a lot of his own wisdom teeth extractions and things like that. So yeah, it's fun, a lot of fun. You'll love hygiene. It's good. All right, any other questions? Okay.